Good evening, ladies and gentlemen, and this evening we'll be talking about cataract. This is Group 1, and our members are Ayana Alexis, Celine Charles, Jolene Dolphine, Angel Farrell, Darren Matadine, and Donnell Primus. A cataract is a clouding of the lens of the eye. This area of the eye is normally clear as the clouding happens to keep light ray from passing through the lens and focusing on the retina. In its early stages, a cataract may not cause problems but may affect only a small part of the lens. The main type of cataracts are mostly related to aging. However, other types of cataract can develop earlier in life, such as congenital cataract, which are present at birth, secondary cataract, which usually happens because of another disease in the body, or traumatic cataract, which can develop after an eye injury. Some causes of cataract. Let's start with aging. Cataracts are predominantly age-related, with age being the primary risk factor for their development. An individual grows older, the protein in the eye lens can clump together, forming cloudy areas known as cataract. Diabetes mellitus. Diabetes mellitus, another known cause, especially when poorly controlled, is a significant risk factor for cataract development. The high levels of blood sugar associated with diabetes can lead to the accumulation of sorbitols within the lens, causing osmotic stress and ultimately contributing to cataract formation. Then there's smoking. Smoking tobacco is a modifiable risk associated with an increased risk of cataract development. The toxic component of cigarette smoking can directly damage the lens and accelerate the formation of cataracts. And lastly, ultraviolet radiation exposure. This prolonged exposure to ultraviolet radiation, particularly UVB rays, is associated with an increased risk of cataract formation. UV radiation can cause oxidative damage to the lens, leading to the development of cataract over time. Some causes associated with cataract. Cloudy or blurred vision. This makes it more difficult to read, drive a car at night, or see the expression on a friend's face. Also, seeing through cloudy lenses is like looking through a frosty or fogged up window. Poor night vision. This type of night blindness is a type of vision impairment, also known as nyctalopia. Sensitivity to light and glare. The glare causes the bright light. The bright lights can be very painful, according to the Mayo Clinic. This starts at the back of the lens, blocking the path of light, and often interferes with your reading vision. And lastly, increased nearsightedness. This increases the need for changing eyeglasses prescription. Alternative treatments or intervention. There are no alternative medicines that can stop the growth of cataract. There are some supplements that can improve eye health and slow the growth of cataract. Eating more antioxidant-rich foods may help maintain good eye health. foods such as leafy greens, peppers, cherries, and berries. Berries contain high levels of beneficial antioxidants for eye health. Eating fish may help prevent cataracts. In one study, researchers found that women who ate fish 3 times a week rather than once a month lowered their risk of cataracts by 11%. However, there are no definitive studies that support any alternative medicine. A 2014 meta-analysis looked at data from studies involving 42,000 subjects. It found that dietary intake of lutein and zeaxanthin was associated with a lower risk of developing cataracts. Lutein and zeaxanthin can help filter out harmful ultraviolet light in an eye's lens. They may also help stop or minimize damage to the protein and fiber in the lens. Omega-3 fatty acids are known to fight inflammation. Many studies have found evidence that dietary intake of omega-3 fatty acids is associated with a decrease in the risk of developing cataracts. Animal-based researchers have shown that bilberry extract may help protect the lens of the eye from UV damage. This herb is also rich in antioxidants. However, too much can cause bleeding and blood clots. Please see a doctor before using. While there are limited research into the use of alternative medicine for cataract prevention, making healthy lifestyle choices can certainly help in the prevention of cataract and support your overall health. It won't reverse the condition. Currently, surgery is the only effective treatment for cataract. Thankfully, the procedure is safe and doesn't require a lengthy recovery period. Surgical intervention. There are 3 major cataract surgeries, which are phecomullification, extracapsular cataract extraction, better known as ECCE, and femtosec laser-assisted cataract surgery, better known as FLACS. Let's start with phecomullification, which is the most common procedure performed to remove cataract. It is done by making a tiny incision on the side of the cornea. Then the doctor places a probe that sends out ultrasonic waves, which softens and breaks up the cataract so it can be removed and replaced with a new lens. Secondly, extracapsular cataract extraction, better known as ECCE, is the second most popular, which is done by making a big incision to remove the entire cataract rather than using ultrasonic sounds to break it up. Femtosec assisted cataract surgery, better known as FLACS, is a procedure done by laser. And some of the manual processes in the surgery are removed, such as making the first incision, opening the lens capsule, and dissecting the lens. What to expect? A week prior to the surgery, a thorough outpatient medical checkup is conducted, which includes laboratory testing and X-ray. The cataract is removed on the day of the procedure, and the patient returns home, where the home care for the eye is expected for the next 2 months. During this time, your doctor will meet with you 3 to 4 times to ensure the eye properly heals. Risk of surgery. Most times, cataract surgery is successful. However, undetected disease in other parts of the eye can affect the outcome, even in patients with great surgical results. Just like all surgeries, problems are a possibility. Cataract surgery is no different. Bleeding, infection, or inadequate healing can occur. Any of these conditions could impair eyesight or even cause blindness. Conclusion: many people develop cataracts as they get older, but there are ways to reduce your risk. Limit your exposure to UV light, avoid smoking and alcohol, and increase your intake of yellow or dark green leafy vegetables. Make sure you get plenty of omega-3s and consider taking bilberry or turmeric supplements. If you have diabetes, make sure to keep your blood sugar well controlled. Regular eye exams are also crucial for early detection and management of any potential concerns. Ensure you can continue to experience the world's beauty to the fullest. Our references. Good evening, ladies and gentlemen. This brings us to the end of our presentation. Thank you for listening. Goodbye.